The Small Rural Hospital Transition Project, or SRHT for short, began in 2014 and is now coming to a close. SRHT has been a project of Rural Health Innovations, a subsidiary of the National Rural Health Resource Center. SRHT has been funded by the Health Resources and Services Administration's Office of Rural Health Policy. SRHT has supported 52 small rural hospital projects located in areas of persistent poverty by providing on-site financial and quality performance improvement consultations, education, and developing and sharing resources to assist hospitals in transitioning to value-based payment systems and population health.
I think it's very important for other hospitals and their boards to move to a value-based system. One, I think it's just the right thing for our communities and our nation to move to. We've done it the other way for so long. It's going to take some changes to get there and get there profitably, but I think they're going to be left behind by doing it the old way. I think we need to train our communities, our individuals in our communities, and train our staff so that we're treating people ahead of time and trying to keep them healthy versus just reacting when they become sick.
The on-site consultation by the SRHT team really helped us focus. I think we thought things were just not within our reach before, and through the consultation process, we found out that they absolutely are.
The measurable and non-measurable outcomes of the SRHT consultation projects have been astounding.
We've been able to find multiple opportunities to improve our financial position. One of those being that we've been able to reduce our bad debt by 25%, just over $1 million in less than a year. We've been able to increase our point of service collections by 22% on the clinic side and by 15% on the hospital side as a result of implementing a system called Freesia, and also providing estimates to our patients for surgical services and pre-scheduled services. As a result of the Charge Master Review, our hospital has been able to increase our collections by $2.25 million from 2017 to 2018, and $1.4 million of that was shortly after SRHT came on site and did a Charge Master Review. We performed a FEMA, which is a failure result effect analysis, and we were able to identify multiple places where the claims were failing, and as a result we've been able to reduce our past timely filing by over 52%, no prior authorization denials by 77%, and our registration errors by 60%, resulting in more revenue coming into our hospital. Our days in AR were 71. And today they are sitting at 50, so we've seen a decrease in 21 days in just a year.
340B went live with us, June was a year ago, so we've been going for a little over a year and have realized almost $130,000 worth of savings and reinvest them in ourselves and our community.
Many of the SRHT projects were so successful that we created hospital spotlight articles and videos so other hospital leaders could learn from and consider implementing best practices. The reach of SRHT has certainly been wider than the 52 projects we supported with consultations. Another accomplishment of the SRHT project was to create resources based on the findings from the consultation projects that would be available to assist other rural hospitals. The Rural Hospital Toolkit for transitioning to value-based systems and the Self-Assessment for Transition Planning were created in 2016 to house the carefully selected resources, strategies, and best practices identified through SRHT consultations. Over 250 rural organizations have taken the self-assessment, which sends related resources instantly based on assessment results. The toolkit shares best practices and outlines strategies for improving financial, operational, and quality performance that position rural hospitals and networks for the future. Rural providers and leaders should use the toolkit to identify performance improvement opportunities for their hospitals and networks.
We were focused on reducing costs, and the consultation really shifted our focus to growth. We need to be expanding into markets that make sense for us. And so our whole strategy now for our strategic plan going forward is centered around growth.
We held annual summits bringing together experts on various topics to identify trends, address current health issues, and to develop reports, manuals, guides, and templates that we share throughout our toolkit. SHRT also allowed us to develop educational webinars, podcasts, and videos that live within our regularly updated toolkit.
For us, success in this population-based strategy is performance agreements with payers. And if we're having good outcomes, that gives us the ability to go to payers and say, these are our results. Let's now enter into a payment agreement contract. Before, we were not prepared to be able to go and have that conversation to negotiate contracts. And through the SRHT project, we now are.
Ultimately, the goal of SHRT is to improve rural hospitals and the lives of people living in rural communities. We collected data pre- and post-project from our hospitals, but we wanted to go a step further and measure the return on community investment, or ROCI, which is a methodology for measuring the value of our SHRT project to the community. The total ROCI is based on hospital operating margin, productivity, revenue, and the measurable impact of SHRT training and education.
We were able to provide a lot of more education to our board. We continue that with our medical staff, our department heads, everybody across the board.
And the consultations with the SHRT project allowed us to open up our eyes and see the needs that we needed to work on to improve the quality of care for our patients.
Being able to have someone come in that's visited a number of different critical access hospitals, validating that a benchmark was possible, that critical access hospitals could do something, and it was happening in another facility, so why couldn't we do it here? And then we did it. We accomplished it.
We have learned so much from working with hospitals and visiting rural communities. Our SHRT project is coming to an end, but the work to transition rural hospitals toward value and population health will continue. Stay tuned for details on our next project.